Welcome to Montgomery Matters. I'm Greg Wims, your host for today. Today we're going to talk about acupuncture and all the benefits that arrive from having this kind of treatment. My guest is Hung Ji, who's with the East West Wellness Center in Rockville, Maryland. Welcome to the show, Hung Ji. Yes. The first question I would like to ask is, tell us, what is acupuncture?
Yeah, acupuncture is a traditional medicine and practice in China about 5,000 years ago. It is believed there is a vital energy or life force circulated around our body through certain pathway called meridians. Right? If this vital energy or life force got disturbed, then illness or mild body function may occur. Okay, and by inserting needles into certain points along these meridians, we can regulate the energy flow, balance it, and restore.
Now that brings me to the question, do the needles hurt?
No, it doesn't hurt. Okay. The needles are very, very tiny. Okay, it's like two hairs put together.
Oh.
And nowadays it has a tube. Okay, we can show the needles later on. You want to show it now?
Yes, we will.
We can show it later on. Yeah, it comes with a tube and pre-packed and disposable, and people don't have to worry about anything. And I put it in very firm. And you see normally about our pain, sensation is the skin pick it up. Okay, and skin have the pain receptor and send it to the brain. So we have to put it in very firm, very quick. Before that happen, then it stop, so you don't feel anything.
Well, let me ask you, who would benefit from acupuncture, or who should come to see you? What symptoms would they have when they come to see you?
I think nowadays a lot of people know acupuncture help with any kind of pain reduction. Okay, and like headache and lower back pain, neck, shoulder, or stomach pain, any pain related, even if arthritic pain. But actually, acupuncture help more than pain. As I mentioned just now, it regulates our body's energy flow. In Chinese, it's called the qi.
The qi.
Yeah, spelled Qi. Okay, since it regulates the energy flow, it can help a lot of problems we have.
Well, now I think what would be good if we look at some pictures, and maybe you could explain to the audience what the symptoms are and how you're treating it. So I think we have our first picture up now. If you could talk about that picture.
Yeah, this picture I think is about, you see, this gentleman has a lower back pain. Okay, he came like two months ago. And before he came, he went through 2 surgeries. One is within 2 years, due to the herniated disc. It's a work-related injury. Okay, when he came and he had no range of motion, he was in a lot of pain and in a heavy medication. Okay, even if when he walked was not straight, always tilted to one side. And he also not only pain on the lower back region, and also he has the numbness and the tingling, down the leg. He used the word the burning sensation all the way through the toes.
Now, how is he today? You said 2 months ago he started the treatment?
2 months ago he started
Tell
treatment.
Tell us about his, is
and
he mobile?
Gradually, yes, now he's mobile, and he can tell he walk very straight, And before he complained, like climbing up the hill, he couldn't do it. Now he's able to do it. And also, and about his range of motion, I mentioned he didn't have any range of motion. Now, when I put some needles into certain point, I asked him to do the exercise. He was able to perform that with 90-degree go down now. You can see, you see for treating the lower back, Okay, I not only that's lower back, and not only you see put the lower back, the needles into the lower back. I don't know whether you can see the scar down there, all the way from L1, you're probably down to L5, not the surgery scar. So down there, okay, I put several needles down there, and along the meridians, we talk about the meridians, the pathway, okay, along the meridians, then I'll put needles, okay, down the leg. There might be another picture about the leg. I put the needles down there. Okay.
Now let me ask you with that, you said with the different channels as you're putting the needles in, this gives, as you call it, is it the
meridian?
Meridian, okay.
Yes.
Okay, well thank you. Let's look at the next picture.
Yeah, I think this picture is still the picture about the leg. I put the needles down the leg, okay? Yeah, that's to make the flow, because he also have the tingling and the numb sensation, which can help with that neurological problem.
Okay.
Yeah.
Okay. Then is there another picture?
Another picture, it might be the shoulder. This patient has the shoulder problem. She was diagnosed with the bursitis or rotated calf.
Yes.
She was unable to, you see the range of motion is external rotation. That means in the back, putting the back. Okay, she had a hard time, and also the reaching forward for some objects.
Okay. Now, with that patient, how many sessions did she have to take before she started seeing mobility?
Okay, this is my established patient. She got a different problem before, okay, and this is her second visit for the shoulder problem. Okay, and that problem kicked in like three weeks ago, and she know acupuncture can help, so she came a little bit early. So after the first session, okay, she said she's much better. That sharp pain when reaching for object is not as often as used to be. This is another gentleman. Yes, he has a different shoulder problem. He has the shoulder problem, which range of motion got limited. He also have the neck problem. So I suspect, okay, this shoulder problem, it may caused by the neck circulation. The circulation is not good. And he also have the tingling and numbness down the hand. Okay. So when I put needles into him, I do the neck, okay, and shoulder, go to the scapula, and also the down to the hand. And there is a wire down there. Can you see the wire down there?
Yes.
Okay, so that is called electrical acupuncture. So for such kind of problems, sometimes I hook up the wire, give a little bit current, make the needle tapping, which can further address the problem well.
Yes. Okay, thank you.
This lady, and she has the sinus problem. Yeah, and this is very common point for the sinus. And plus some other points, I don't believe we show that in the picture, but for this, okay, and I have another like young girl, like 14, a teenager. Okay, she got only one treatment just by putting single needles into the forehead, and her mom said the whole year she's been good.
Well, you know, at this picture, I want to stay on this for a second, the sinus, because this is the time of year that everyone is having problems. So do you find that, as a rule, how many treatments would a person have to receive, or how many sessions, I believe you call it, would they have to come to sort of help with the sinus?
For the sinus? Okay, and to answer all these questions, it really depends on how many years you have the problem and how severe it is, if you are taking medication, okay? And for the younger people, they don't have it for so many years. Once or two times, they can feel the difference. Okay, and for some other people, maybe have it for 30 years or 20 years, even they lost the sensation, the smell, okay, that may be taking a little bit longer. But if about 5 or 6 treatment, okay, you don't feel any better, that probably is not the choice for acupuncture, but most people get benefit from
thank you.
there.
And we have the next picture. You can explain that one?
Yeah, and she has the headache, okay, she complained the sinus headache, and plus it's also down the forehead headache, sinus and the stress related. So you can probably see there's one right in the middle, okay, between the eyebrow. There is a needle, and down top of the head, down here I put another one, okay, and also on side of here, Okay, that's for the tension headache. I believe there should be another picture. Can you see the hand down there? Is a needle down the hand? Okay.
Yes, well, we'll get to that. What
Yeah,
about
I
this
think
one
it's on
here?
the, that's the side. We can see the side. And from that picture, you see, and I think we just now probably see the a hand. Okay, this is the meridian, and this meridian, okay, and goes to the other side of the nose. That's why I put one needle into the hand. And also, you see, and I put one down the leg, down the leg. That's help with the symptom of watery eyes. That meridian ends down here. So I put a whole group of, you see.
Well, with that, from the pictures you've shown, I think I'd like to ask. You said something about the hand, and that helped with the sinuses when you put it in the hand.
You see, Greg, I mentioned about the meridians for the energy flow, right? And there are 14, main meridians. Circulated around our bodies. Okay, and let's show this one. See if we can get this one clear.
Let's see if you would hold it right there by you.
I can hold this one down here. Okay, you see all these lines down here. That's the meridians. Okay, and all these dots down here. That's acupuncture points. About 400 points down there.
Okay, let me stop you again. You said there are 400 points on a person's body that the acupuncture could work. Okay.
But commonly used, not 400, but the points are 400. On this side, the inside, the ventral side, 3 meridians on this side. Okay. And on the dorsal side, 3 meridians. That makes 6. And you can also see down here, right? Okay. Yeah, you can also see down here. Okay, and there are another 6 meridians, 3 on the inside down here, okay, and 1 in the front down here, and 1 on the side here, and 1 in the back. That makes another 6 meridians. And another one, another 2, the midline in the front, okay, and the midline in the back. So altogether make 14 meridians. 14.
Now, with that, this is a question I think that our audience would like to know. Do you accept insurance at your office, or how do people pay?
Yes, we do. We do accept insurance. Okay, a lot of major private insurance, they accept acupuncture because they know it saves them a lot of money, like Care for Blue Cross Blue Shield and Cigna, Aetna, United Health. Nowadays, even Kaiser. Okay, and the big HMO, they began to accept acupuncture.
Now, Westerners, I guess you said 5,000 years ago it was started in China. How do Westerners feel about acupuncture?
There are some research, Western research, about the acupuncture. They found acupuncture by inserting needles into the acupuncture points along the meridians. We talk about meridians. Okay, it can trigger the release of endorphin, which is our natural pain-killing substance in our body. Okay, and it can also alter the output of serotonin. Okay, a neurotransmitter contribute to our overall well-being.
Well, with that, we're going to have to take a short break here now, but when we come back, we're going to talk about all the other symptoms that the person may have and how you would treat them with your acupuncture. So we'll be back after these messages.
Making the world a better place is an intricate puzzle. And piece by piece, the women and men of Rotary have worked hard to fight hunger, promote literacy, and move the world toward peace. But there is still much to be done, still some missing pieces. And one of those missing pieces is you. Learn how you can help Rotary put together a better world at Rotary.org. Rotary, humanity in motion.
In 1985, while polio was paralyzing 1,000 children a day, Rotary International committed to a goal of ending polio worldwide. Very soon now, after immunizing over 2 billion children, the goal will be achieved. Eradicating polio worldwide, that is humanity in motion. That is Rotary.
Welcome back. You're watching Montgomery Matters. I'm Greg Wims, your host, and we have Hung Ji, an acupuncturist who will be talking with us today. She's the owner of East West Wellness Center. Hung Ji, before we took the break, you were talking about how the needles actually help to cure some of the symptoms. I wanted to ask you, could you tell us some of the many symptoms that your patients have, and then we'll talk about how you treat them.
Okay, the majority of patients is still like pain related.
Mm-hmm.
Okay, and like lower back pain and shoulder, neck, knee, and ankle, also headache, all kind of pain. And for the past, recently, for the past 4 or 5 years, I've been practicing in my location, Shady Grove, for about 11 years.
11 years.
Yeah, at that time, and majority is like pain related. And nowadays, I see more and more other like internal problem.
Mm-hmm.
Okay, people tend to seek help from acupuncture. Okay, and like indigestion.
Mm-hmm.
Okay, and sleeping. Anxiety, depression, okay, and a lot of young people, school kids, have focus problem, okay, and even, okay, have you ever heard of IVF?
Yes.
Okay,
yes.
and even the IVF, okay, and there are a lot of research. If the patient take acupuncture, the successful rate is much higher than just taking the regular,
Yes.
okay, and procedure.
Now, you've given us a list of things. I want to focus in on 2 that you mentioned. One was for students, attention focus, I believe. I'm not sure, what was it, students who have trouble focusing, is that?
A lot of kids, they have, it's not as soon as you have the focusing problem,
Yeah.
okay? That's okay, like going on school, work, you can see they are great going down, and then they kind of nervous to go to school, okay? And exam, when the exam, the final exam, they prepare well, but couldn't sleep the night before, okay? And then they take acupuncture, that symptom got improved.
Now, for that symptom there, where do you put the needles? Do you have them more forehead or shoulders? Where would you place the needles?
I will place it depends on the symptom, what kind of symptom I have, but generally speaking, we'll have down the head
Okay.
and the arm and the legs,
Okay.
because I try to